An effective and appropriate consultation is a tremendously important part of what you offer as a healthcare provider. Welcome to AMC. I'm Dr. Greg Miller. Have you ever thought about the importance of the initial consultation with your patients? Today, I'm going to explain why this step is so critical to getting your patient to understand their chiropractic experience. You won't want to miss my advice on friendship practices. If you find this video to be useful, please click the like and subscribe buttons. Let's get started. Well, greetings. I'm here today to talk a little bit about consultation, and most specifically a properly done consultation. But let's go ahead and start with the reason that a consultation is so important. In my work with AMC, it is common for me to run across situations where doctors are either not doing a consultation or they're combining that with an exam and ultimately even a first report. And so they're putting a lot of information overload into a patient before they even deliver the first adjustment. And so my purpose here today is just to kind of outline the importance of a consultation, which that would be the other point, is they're not even doing one at all, and certainly don't have a room in their office dedicated to it. And I would like to challenge that thought process with a consultation. When it's done properly, this is your first opportunity to do several things for a patient, not the least of which is to make sure they understand who you are, to like you, and then to begin that process of valuing and respecting what you do for them. One of the number one complaints that patients have about the experience that they have in the medical community or with healthcare providers is that my doctor doesn't listen to me. Doctors, the consultation is the ideal opportunity for you to help your patients understand, look, there's something very different about to happen in this doctor's office. This chiropractor is actually sitting down, listening to me, and allowing me to explain what my concerns are. Because we have to remember, the patient brings with them a tremendous desire to get help. They may cover that up in all kinds of different ways, but the reality of it is they have a tremendous desire to get better, that condition that they're bringing to you. And if you don't listen to them to hear what that is, you're missing that opportunity. Hence the importance of a consultation, to the degree that if you don't do one or you don't do a good one, I would argue that you may never get a chance to do a report, or in our world, a first report where you explain their condition, or a second report where you talk to them about what it's going to take to correct their problem, or adjustments through the acute phase of care, or even into long-term lifetime care. You'd never get an opportunity to do any of that if you don't do the consultation properly. So an effective and appropriate consultation is a tremendously important part of what you offer as a healthcare provider. Look, we've spent the last several years talking about how to be the go-to doctor in your community and the importance of that. And certainly our current health situation would demand that that's who you become. Yesterday, Dr. Brubaker and I were talking about office evaluation, actually in a webinar, and he brought out the point of how important the setup of the consultation is. Does it look professional? Do you look professional? We can get involved in all of that and the importance of it, but ultimately, what you need to understand is that a properly done consultation allows you to begin the process of taking a patient who, at no fault of their own, is of the opinion, if they've been to a chiropractor before, very likely, of the opinion that I'm in pain, I need the chiropractor to take me out of pain, and then I'll come back, I'll stop coming when I'm out of pain, and then I'll come back again when I start hurting. And that is the definition of a pain practice / what we call a friendship practice. Ultimately, it's the inmates running the asylum. And I can give that, I have built pain practices in the past. I have built friendship practices where it's all driven by new patients coming into the office. And I talk to doctors all day long. I just need new patients. I just need more new patients. Well, the truth is, we need to understand that patients' desire the answer to correct their problem. They desire that. They just don't know how to communicate it to you. And if we're not listening, they're certainly not going to have that opportunity to communicate that need to you. The practice that I had in Nebraska, I was very much a technique guy. That's not important. All of you have hopefully mastered a technique. But my training was to get the patient out of pain as quickly as possible. Hopefully they'll refer somebody and then come back when they're hurting again. The problem with that is each time they came back, be it 6 months later, 6 weeks later, or 6 years later, their condition had worsened and I hadn't done a proper job of explaining to them what happens when they ignore this condition. And the consultation, literally, folks, is your gateway to the opportunity to do that. So when we do a consultation effectively, the principle that really comes from that is it's the start of the process of taking a patient from the mindset of pain, which we talked about, to the mindset of, wait, this is a condition that could potentially be with me for my entire life if I don't correct it now, and then stay on board with chiropractic for a lifetime experience. That's our desire. I know I said the word consultation a lot in our time together today, but it is, if not the most important part of your new patient experience and your patient's experience. It's certainly at the very, very top. And I know a lot of you believe as long as I get them feeling better, as long as I deliver fantastic chiropractic adjustments, which is great, it's part of the process. But again, if you don't do that consultation right, if you don't do those first few visits correctly, you never get the chance to prove that you're a fantastic chiropractor. If you would like to debate that a little bit more, or if you'd like to have a conversation about that, I'd welcome it. It was great being with you today talking about consultation. Would love to talk with you more. Go ahead and click the link on this video and reach out to us. And we'd love to visit with you. Join us at our next training weekend, February 24th to 26th. If you're new to AMC and would like a free guest pass to 3 days of material like this, text us at 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice.